Good afternoon, Patriots, and welcome to the 88th audio chat on the Q News Patriot Rumble channel series. I am the Q News Patriot, joined today by recovering Chief Executive Nurse and Patriot, Patti Gilliano. My name is SG Anon. One of the things that we don't shy away from on our broadcast here at QMP is the discussion of what happened to the planet 4 years ago. We saw the inauguration of an agenda most foul, to utilize that terminology, and to say that it affected each and every one of us in varying degrees and ways seems the understatement of the millennium. Patti was right in the middle of a great deal of that as a nurse executive and as a chief nurse involved, with the healthcare system. And she got to witness tremendous things that occurred within that system that eventually drove her to a career change, a reorientation, and a new purpose for her life and for all of us moving forward. It's a pleasure to have her on today. Patti, thank you very much for coming on the show.
It's my pleasure. I'm glad to be here.
Well, the pleasure is indeed mine. I hate to be redundant in stating that, but fundamentally, when I got to hear about your account, the book that you've written, the things that you've lived, it was indeed an honor to get you on the show. I wanted to get you on as quickly as we were able to on the calendar. You're meeting my audience for the first time. So usually on the show, I have people go through a little bit of their personal background. It's interesting that I think some of yours is going to tie in directly to your story. So if you don't mind, could you take just a few minutes and tell us who Patti Gilliano is?
Yeah, absolutely. I grew up a Philly girl in Philadelphia, Pennsylvania, and very fondly memories of watching the Rocky story unfold, which will be important for later on in what I share. But I was a nurse, didn't really know where I wanted to go in my career. I spent a lot of time, my first few years, I was in all aspects of ICU, critical care, emergency room, perioperative. I spent a number of years working in perioperative arenas, taking care of patients in the acute care setting, and grew in leadership and was, I guess, blessed with the opportunity to not only go to school, but work at the University of Pennsylvania. Graduated there with a master's degree in nursing and business, and then began spending a lifetime in my career helping others just to become from baby nurses to nurse executives and growing operations across hospitals in the country to help them be successful, driving the patient experience. And the patient experience was always something that was paramount to me because it's about making a difference and taking care of people, saving lives, and doing the right thing at all costs. And I had been through the AIDS pandemic. I had been through, or I should say the epidemic, Ebola, the swine flu, bird flu, avian flu, you name it. And there was always one thing that stood out, was that we would always try different things. And for the first time in my career, when I had taken upon a new position in Idaho as a chief nursing officer, I had already been an experienced executive for about 11 years. So this wasn't a new job for me. And I had also been part of the Las Vegas mass shooting and was there at the helm, at the epicenter of when the Vegas shooting took place. And so emergencies are not foreign to me, emergency responses and how you deal with things. And what was unique in February of 2019 was we had this mass call to action. And I remember, as I put in my book, They Call Me Harriet, which I've just published on Amazon, that I was called to the Oval Office to discuss how we were going to handle a command center of epic proportions about COVID. And in all my years of experience, knowing sterile and aseptic technique, of having spent probably close to 16 years as a very well-developed and educator in perioperative nursing, which means you really have to know your stuff to keep areas sterile, safe, and protect people from infection. So that was something that was paramount in my career and my background. And when all this happened in 2019, I was just dumbfounded at the mass exodus of people's critical thinking. And so that's what led me into this journey, and why I'm so excited to be here with you today, because at that point in time, I found myself face to face in the helm of working with people that lost all sense of common sense. And no one really had any thought process as to, why don't we question things? Hold on a second. It was at the end of a very divisive political time. There was a lot of changes happening from November 2019 into January of 2020. And everybody just seemed to drink the Kool-Aid and go along with the masses. And so for that, it was really difficult. And so I found myself eye to eye with my CEO, who questioned why I didn't agree with the narrative. She put my job at risk, and ultimately I ended up becoming in a position of having to question why I was even working there. And so she relegated me to mass casualty areas and sent me off to different locations because she felt that I was a threat, I guess, to that organization. It was the first time in my career where we laid off over 400 nurses. And during that time, that's when I became very involved in what didn't look right or sound right. I wanted to get the word out to people that we've got to start thinking about what's really happening here. And that was the summer of 2020. And I had seen a quick TV news brief from Dr. Peter McCullough. And I remember the stuff that he was discussing about ivermectin. I never realized how important it would be to me for my own personal self. And at the time, we were using hydroxychloroquine in the hospital. And in the hospital, we were saving lives. Everybody was going home. And, you know, the daily data drop, we were sequestered literally every hour to these Zoom calls from local hospitals to divisions to the entire country, because I worked for a very large organization. And in that time, no one seemed to question. And we would document supplies, we would document masks. I've never seen, you know, even prior to all of this, we never had the opportunity to be able to have such resources available to us. And yet they were also at exhaustion levels and masses of ventilators. So that's kind of what led into this whole discussion I'd love to share with you today. But that's kind of how it all got started. And that's where I started as a baby nurse in Philadelphia and traveled the country.
You know, your story is absolutely incredible, and I'm willing to bet it is significantly related and relevant to a lot of similar stories out there from healthcare personnel the nation over, and indeed in the entirety of the Western world. You said you came up we sort of stopped the timeline there with about mid to late 2020. Can you take us through 2021 and 2022 and maybe bring us forward to the present and what inaugurated the idea of the book Within Your Soul?
Absolutely. So shortly after seeing that we were making a difference in saving lives, where I became paramount as a chief nursing officer was when everyone was locking down. I was kind of vicariously sneaking in or asking for forgiveness, not permission, to bring patients' family members in to see patients that not everyone had COVID. Some did, some didn't. And if they were at death's door, I was able to get patients' family members in. And it was very troubling to me. And, you know, I was speaking against many facility physicians, and every one or two that questioned things like I did, they were shut down. And so I didn't have protocols or anything to share that were controversy at the time, but I had heard about this ivermectin, and I saw that hydroxychloroquine was working. And even some physicians were going as far as to use IV infusions of B vitamins and C as well. And it wasn't too long after that, for some reason, even the hydroxychloroquine was stopped at our facility, and patients started to get sicker and die. And then my husband came down with COVID, and I was very afraid for him. And I thought surely it wouldn't be me, because I was an avid runner, 2 miles a day. I worked out all the time. And he seemed to have a pretty bad cold, flu symptoms. But 5 days later, I came down with COVID. And I couldn't believe how sick I got. And it didn't hit me the way it seemed to hit most people respiratory wise. And so what ended up feeling like a bad upset stomach and really difficulty breathing became incapacitating. I was turned away from my ER the first time with a collapsed lung, no less. They said, well, you know, you're still breathing on your own, and we're really at capacity, so go home. And if you feel worse and your lips turn blue, then come on back in. I called my doctor. I had to see him by Zoom, and then he said the same thing. And the next day, I was passing out every time I stood up to try to get up and move or go to the bathroom. And it wasn't because, you know, I was just sick or I was tired. It was because I didn't have enough oxygen to the brain. Later that night, my husband said, why don't I just rest? And I said, if I do, I'll probably die of asphyxiation. And so he took me back to the ER, and they admitted me to ICU. It was a really scary time for me because I've never been sick, and I was extremely healthy. And so my next couple of days in ICU, I made some life decisions. And there it was that I couldn't see my family. I couldn't really get any support. And it's where I got to experience firsthand what the protocols did to patients. They isolated them, and I was extremely isolated. I couldn't really talk to family, one, because I couldn't breathe, but two, because they lied. They said they would reach out and call our family members, and I believed my staff were doing that, and they didn't. And so I had no communication from the staff or the physicians to my family. What information I did get out, I had my family make last arrangements for things that were important to me that I could. And I also lied to my sons and didn't let them know how sick I was, because I just didn't want them to panic and come to the door and not be let in. So it was a very traumatic time for me. About 2 weeks later, I was able to leave the hospital because I wasn't getting any worse, but I wasn't getting any better. And I had accepted the treatment that they said I needed to have with remdesivir, which I sadly call remdesivir. I didn't know how toxic it was at the time, and I didn't know that it failed for AIDS patients, and I didn't know that it was failed in Ebola, that it caused over 50% death when it was used. And I had 5 doses of it. So when I got out of the hospital, I was sent home on 6 liters of oxygen. And if anybody knows what that's like, when you can't breathe without oxygen and you've got someone who's otherwise healthy, it was absolutely debilitating. And my lungs felt like they were filled with cement. And so what I ended up doing when I got home, my husband had to go to work because he also worked at our facility as a facilities director. And he was there for crisis management, so he had to go in. And so I was on my oxygen, propped up on my sofa. And what show came on, but the first movie that I had seen that I mentioned was Rocky. And it was a Rocky marathon. And watching that movie, I spent the next 8 hours watching all the episodes. And it prompted me to say, hey, girl, you can't give up. You've got a story to tell. You were in ICU. You begged God to live. And because I asked if there's anything I could do to make a difference, I felt like I needed to get into action. That's the time that I decided to start making notes about I was going to write a book, and I was going to get out there and make a difference with one person, one patient every day. And from that point, what ended up happening was I had to figure out how to fix myself, because I couldn't function on anything less than 6 liters of oxygen. And as the days went by, I reached out to every colleague that I knew across the country. I was trying to get into a hyperbaric program, and they said, well, you have to get a little worse. We need to give it a month. And if I gave it a month, I probably would have been so fibrotic, they probably wouldn't have been able to help me. And I found a doctor up in Idaho. I call him fondly Dr. House, but his name is Dr. Hartford. And he did experimental treatment, at least experimental by the medical model, and he did IV ozone. We didn't know how successful it could be, but I knew it couldn't hurt. And I ended up going in to have IV push, IV ozone, which you literally push ozone into your bloodstream, which is filled with gas and bubbles. And so technically you could throw a PE or an air embolus, but I was so debilitated, I said, I'm either going to fix this or I'm going to die, and I'm not going to live my life like this. So over the next couple of weeks, I had done 2 treatments of IV ozone, and the very next morning, I was able to take off my oxygen at rest. I still needed it to walk, and I developed my own cardiac rehab program. I was blessed enough to be with people, I think, who were far enough removed from the mainstream that when I went to Orange Theory, they allowed me to train with my oxygen, which allowed me to have the most phenomenal cardiac rehab program I could have ever designed, because it allowed me to expand my lungs and my O2 capacity while increasing oxygen at exertion. So that was a 3-month mission. And by December of 2020, I was able to walk. I was able to ski. I took a tremendous amount of time to repair myself, because I had intended that I was going to be on a fight for my life. At that time, as I was healing, and in the next couple months, I had started talking to people online who were reaching out looking for help across social media. And we would all talk privately in Messenger, because there was no way to share anything on Facebook because we were blocked and shut down. And I must have come across 300 to 400 people in private messages that I would share my story with them. Ivermectin. I would tell them how to reach out to people to get IV ozone across the world. There was a couple of websites that hadn't gotten shut down, and I was able to connect them with people and treatments. And people that I knew that were able to prescribe ivermectin, I referred them to those providers, because at the time I was not a nurse practitioner yet, and I wanted to make sure any chance had a chance and could find ivermectin. I also had reached out to networks in other countries. There's a couple other drug outlet companies in other countries that you do to get those medications. And so I got my own little stash and supply, and was able to help myself and family who wanted to have it. And I also encouraged people at the time to use other methods to get ivermectin if they were really stuck and desperate, that the paste and the creams that are used in the veterinary shops were actually okay. You just had to have the correct dosage spelled out. And we had created charts that actually had the correct dosage calculations. And then in December of 2019, I went to, no, I'm sorry, 2020. I went on an assignment. I was able to go back to work again. And that's when I visited a hospital in California that was having up to 3 to 4 deaths a day, 144 patients or more in their ICU and ER combined. They had 3 MASH unit tents outside. And that's where I had now, I was able to get in touch with Dr. Corey. Him and I had shared some text messages on LinkedIn, and I took the protocols. And when I took the protocols, there were physicians that hadn't seen them before, and we tried to get them to use them in a couple of the facilities in California, and they were shut down by infectious disease physicians and chief medical officers who did not want to do what I mentioned back with all the other pandemics that we had, AIDS and Taiwan flu and all that other stuff, bird flu. They said, no, you have to stick to the protocol. But it was the first time in my career of over 35 years at the time that we didn't have the right to try and use things off label. Not ever in my career did that ever happen. And that was also at the same time, Dr. Corey had testified at the Senate in December, trying to get the word out and sharing more of that information with people. And it was just a really crazy time. People were scared and people didn't want to take chances to do things that they weren't sure was proven or effective. And while I was in California and sharing those protocols, after I was there and enough word had gotten out, I had taken flyers and put them on cars. I had joined a group called the Former Feds Group. We were in the early stages. They're out there now. They have a website, formerfeds.org. And they also have the COVID-19 Human Betrayal Project. They're out there taking litigation against hospitals that killed their loved ones with the Fauci protocols. And I think one is actually in court today, as a matter of fact, in California. But through that whole time in January of 2020, all the way in through the summer of 2020, I had been working to try to get the word out to folks. We had been doing all kinds of flyers. We would put them on cars. I had been talking to people on Messenger. And then I was let go from the hospital in California, returned back to my home state of Idaho at the time. They said, yeah, we don't think your work is needed here anymore, and thanks so much for your help. Meanwhile, they had increasing deaths, increasing tragedies, and no one wanted to let family members in to see what was actually happening. And what was actually happening in the hospitals at the height of this pandemic was the staff were overtaxed. They were putting everybody on ventilators, and they weren't allowing people to really look at what the underlying causes of pneumonia and underlying causes of breathing difficulty were. And those underlying causes were because of vessels, blood vessel inflammation and cardiovascular issues where blood clots were forming, and they wouldn't allow them to treat the inflammation. And so people would go on ventilators, be dehydrated, dried out, go into kidney failure, and die. And if a family member had been present to see and look and ask questions, they would see the patient deteriorating. They also didn't see patients that would sit at the bedside unable to feed themselves, and trays got left unopened because there was really no staff that wanted to go in a room of a COVID positive patient. So while the meals were taken in and removed, most of the patients weren't eating or able to feed themselves, and many patients died. When I was in the hospital in California, while they were busy coding 2 and 3 patients down the hall, another patient had his ventilator become dislodged, and he didn't die from a death of a disease. He died because his vent became dislodged and he wasn't getting air into his body. And things like that happen in many cases, in many places throughout the United States, because staff were just constantly running and not taking the time to really look at what was going on with each and every one of these patients. That continued through January, February, March into 2021. And then I was able to take a position in another healthcare system. There I was over 3 hospitals in Texas. And part of the behind the scenes that happened in many of these hospitals, we would be met with hourly to every 4-hour updates and mandates. And it was coming straight out of the CDC. All of the mandates with 7 to 10 to 20 pages of dialogue and rhetoric of, you will do this, you must do this, this is what has to happen. It was straight out of George Orwell, 1984. It was the establishment. Only in our case, they called it the guidance. And that term, the guidance, reverberated from February of 2019 our 2020 all the way through to present day, the guidance. And what was fascinating is between the CDC, the FDA, the drug companies, all of these protocols that are put out, the CDC has guidelines for us on how to earn reimbursement and how we're paid out. And up to prior having had the pandemic hit, we were paid out based on hospital quality metrics of heart failure, the best rates for preventing heart failure, the best rates for preventing sepsis, the best rates for preventing morbidity and mortality, the best rates for surgical site infections. And that all stopped. And for the last 4 years, all that we saw were COVID deaths. How many people were ventilated and how many people weren't? Hospitals were paid based on how many COVID patients they had. All of those other protocols and guidelines went by the wayside, and nobody was looking at how we measured to save lives. We were just counting bodies and how many people we had treated and how long we had treated them. So the metric changed. And it didn't really start to come back until about September of 2023, when all the subsidies started to go away and reimbursements got cut. So it was quite a fascinating change from health and wealth to death and illness. And that's what people were measured on. We used to measure on patient satisfaction. Well, how could you be satisfied if the nurses never came to your room because they, quote unquote, clustered your care? When I was a patient in the hospital, I was lucky I saw a nurse once every 5 to 6 hours. Sometimes it was once every change of shift. Protocols were broken in front of me as a patient. And when I questioned them, I was poo-pooed. We weren't allowed to have patients' belongings come in. So if I was getting blood pressures, I was supposed to use a separate blood pressure cuff and machine for each individual COVID patient. And when I was a patient, I had a tech wheel in a machine that was used up and down the hallway. And when I questioned her on it, I was told, oh, well, it's okay. She wipes it down outside the room. Well, this was the very hospital that I worked at, and that wasn't the process or the protocol. And we were supposed to use individual units. So that went on throughout the entire pandemic, and not just in one hospital, but many. And the nurses, it's really astounding, but nurses didn't question. Nurses just stopped critically thinking. And I would say in 100 nurses, there were maybe 3 or 4 that also didn't want to follow along the guidelines like I did. And those poor nurses were just basically ousted out the door. They were belittled. They were told they weren't doing a good job. They weren't effective. And many organizations didn't hold on to them, as you'll see when the vaccine took place and people stood their ground. But it was interesting because most nurses actually enjoyed the fact that they didn't have to go into the rooms every hour, that the patient experience was kind of put by the wayside, and they spent more time on Facebooks or taking pictures or calling out because they wanted to be home with their family. And all hospital policies of, what the expectations were for showing up to work went by the wayside. So it was quite a unique time. It was a scary time. And I feel like patients did not get good quality care. In fact, the priority was everybody who came in was labeled with COVID. Everybody was isolated. People were mistreated. And they followed one protocol, the protocol that came out from the CDC and Dr. Fauci. And that was the one that prevailed. And that one was the one that caused the most deaths. No one ever looked at what the individual symptoms were that caused the pneumonia, that caused the inflammation. And had they been willing to do what they have done for at least my lifetime of a career, now 38 years, and really look at the underlying symptoms, they would have used things that would decrease inflammation, decrease vascular irritation. They would use blood thinners. They would do things that were going to save lives. And for some reason, the masses chose to just follow the edict. And that edict was driven out by Fauci's protocols. And he was at the helm of most of those decisions. And that carried through. And all the way to this day, they're still using remdesivir. I would say that while things kind of settled down and the virus mutated and it became less and less virulent, and now it's more of a cold or a flu symptoms, and it continues to mutate. They're still using the same protocols. They've not taken remdesivir off the shelves. And what I learned from a scientist, who maybe you'll have on your show one day, He has broken down not just this virus and not just this vaccine, but he shared that remdesivir has about 11 different strains to it, so that if you're using remdesivir, if you got one type, you may have survived. If you got the other type, you probably would have died within a very short period of time. So I was not aware of this until just about 6 months ago, that there was more than one quote unquote remdesivir. And it's just the way they designed the molecules. I guess some to be more toxic than others, so everybody didn't die at the same time. That's purely speculation on my point. But between that and the vaccines and what I've learned about the vaccines, that's a whole other story. And then the vaccine mandates. I had to jump through hill and dale and then some to being a leader in a hospital and managing to navigate the mandate of the vaccine. I actually had put in for a medical waiver and a religious exemption. I was denied the medical exemption despite the fact I had a very valid and well-documented reason not to take the vaccine. But then I was given a religious exemption. And then after all this had come to pass just this past year, they waived the medical vaccine and approved that too after things started to get hot and heavy out in the litigation front. But so many staff lost their positions because they stood their ground. And I applaud them for being strong, because now we've learned so many things that are in those vaccines that really it's just not when it's going to happen. It's going to cause problems in people's bodies. And we just don't know how those long-term effects are going to be. But that's kind of the 30,000 view, if you will, of what happened during that time. And so many things went on behind the scenes that I witnessed, that I literally, in my book, I did share stories of where I would go in and I would hold patients' hands so that they didn't have to get restrained, because staff and physicians wanted patients restrained because it took too much effort to try to not to keep them off the ventilator. And so it was much easier to restrain and tie a patient down and just use the protocol as intended so they didn't fight. And many patients that I did get that opportunity to spend their last days with, I was at least able to try to help keep them comforted. And in many cases, I would try to get family members in, but it was a hard fight because I couldn't help everybody.
Ms. Gilliano, I've been listening to this recounting with just unbelievably bated breath. And I'm having a really hard time distinguishing the story that you've just described from a military-grade Holocaust. And with that, included in that characterization, if we can utilize that, is the application of military-grade psychological warfare campaigns at varying and cascading degrees. It's my understanding that now you're a psychiatric nurse practitioner because of that and other things I think that have been created within your world as a result of this experience. But I want to ask a very heavy question, if I may, before segueing into the psychiatric component, and it regards culpability. We know that psychological operations, especially those of a militarized nature, are designed to produce mass formation psychosis and a very powerful trauma-based fear cooperative response. However, we also understand that there are certain levels of criminality in the world that simply cannot be excused, as I was simply following orders, doing what I was told, or perhaps my consciousness was in some fashion impeded or co-opted. As someone who experienced both sides of this in a very personal way, and I think in very proximally significant time frames, I find myself thinking perhaps that you have a very unique perspective and lens to offer on this very question. So the question is this: to what degree do healthcare professionals and civilians have culpability for crimes against humanity in this process?
I have to tell you, I really agree that there is some level of self-reflection and self-respect that one has to ask. Why didn't I try harder? Why didn't I stand up? Why didn't I say no? And I think it's tough from the nursing world because nurses are trained to take direction. And it's the ones that are far and few between, but you typically find those harder edged nurses in the ICU and the emergency room that will stand up and question because they're always usually advocates for their patient. And I would say physicians, providers, they had the opportunity to say no because they were the ones writing the orders. And that's what I do today. And if I write an order and I don't believe that I'm going to do something that's going to be the best for the patient, I have the obligation, the duty, and the Hippocrates oath to say no. What I'm being asked to do is wrong, and I will not put my name on it, and I will not sign that order. If the physicians were as strong as I had been led to believe over these past 38 years with the AMA, either the AMA was so deeply involved, which I'm beginning to think that's the case, or these physicians really didn't take seriously what power they had standing together. And so I do believe there's a ton of culpability from every aspect, primarily with physicians and providers, but secondarily with nurses who didn't stand up and continued to blindly dot and cross and just chart instead of actually looking at the patient, not the monitor. Absolutely. And if I can add, there is a book that I found when I was sick and recovering from COVID that was on the bookshelves in Barnes and Noble. The book was written by, his first initial is W and his last name is Zhou, Z-H-O-U. The book is titled The Corona Prevention Handbook 101, Science-Based Tips That Could Save Your Life. It was published by Skyhorse Publishing, New York, New York, in 2020. It hit the shelves in March of 2020. In the book, it credits Bill Gates, Dr. Fauci, and an assorted other bunch of people. This book was written by leaders in healthcare in China, and it was on our shelves. And just what you said was in that book. There's an entire chapter on fear and mental illness and psychosis. And basically what the book is, it's a 101 primer to tell you that there's really nothing you can do for COVID except elevate the temperature of your body, stay healthy, hydrate, get lots of exercise, and at all costs, remain calm. For if you don't remain calm, you may find yourself taken into a psychiatric unit and maintained and treated as a psych patient. And there's no mistake in finding that book because now it's really hard to find it on bookshelves. There has been some buried copies in the internet, and I encourage everyone to try to get your hands on it and read it very carefully and see what's embedded in that book, because it was the playbook. It was for all of us who could have stayed calm and said, masks don't work. They're going to let plenty of airborne bacteria in because, like my years as an OR nurse, you're not going to be able to prevent something unless you are fully hooded up and you go through the chambers of visqueen. And most of our hospital units weren't visqueened, which is just this, fancy way of isolating so that you can't let anything out and you go through a double layer. So yeah, I think there's so much that we can look back and learn, and it goes back to your point of fear and making people comply. And what else is ahead for us? Because we've complied. Look at how our lives have changed over the last 4 years in economics, in politics, in medicine. And in medicine, the grand model of big pharma and big money. It's all about the money. It's all about the money. It wasn't necessarily about saving lives at all.
Which leads me directly into my next question regarding your career change and pursuit of passion these days. Healing from something like a psychological militarized campaign that was actuated by every lever of government and certainly every level of state and even local authority and private and public sectors. I think that's a very tall task. We're talking about healing traumas that a great deal of the population, likely even to this day, is unaware that they possess and that they are currently dealing with and managing. So what is, if I may, Miss Gilliano, and feel free to curb me if I'm asking, out of bounds here, but what is the solution to healing both the trauma fear-based program that drove the behavior of so many well-meaning individuals into such a dehumanizing format, and also the trauma experienced by those on the other side of the needle?
And that really is the biggest challenge and question. And that's why I ended up getting into psychiatric nursing. I had had some formal training and had been a leader at several psychiatric hospitals in the past, as well as just the day-to-day acute care side. And I see that, psychiatric need, if you will, acute anxiety, stress, unleveling of people who may have bipolar. All of those things relate back to the instability of emotion. And that is exactly what happened in the pandemic, was the instability of emotion. I lost 2 nurses to suicide in those 4 years. Many people committed suicide during those 4 years, and now still beyond. And to your point, yeah, the trauma, the psychological trauma that exists, I have more patients today that come in with unknown reasons why they're so anxious, unknown reasons why they feel so unsettled, unknown reasons why they've just got sadness and depression looming over them. And then you layer on top of that all the things that are, I guess, relatively present today with just such an up-leveled world that we live in, and I'm speaking economically as well as just all the change and the transition. But, the traumas that are ahead of us from what we've created in the past 4 years, I can't even put the magnitude behind what that upscale tide is going to be. And it goes very back to an early premise that I had that hopefully in the short version, I'll get it to you that will answer the question. But when you become a nurse or work in an operating room, you learn to wear a mask. But when you're in the mask and you're in the operating room, the one thing I learned early on was human behavior. How do you communicate when everybody looks the same and your facial expressions are hidden? And I wrote this little story that's in my book. It's called The Eyes Beyond the Mask. And when I wrote it, it was in February of 2020 when this all hit, or March. And I said, I look at you, but you do not return the stare. I see you, but I seem invisible to you. Do you know what I feel? Do you know what I'm thinking? Did you know I had a rough night? Is it possible we will ever exchange a word? Have we forgotten the human connection? Would you know if I needed help if I did not call out? I now have eyes without a face. My thoughts are hidden. My smile is buried, yet I yearn to connect with the human spirit and compassion. The face is lost, but the eyes will take you to the soul of someone. If we cannot smile on the outside, we must connect. Let it be through our eyes, showing reverence to each other in all that we do, until one day we can smile to each other's faces. And I think that is the severing of what happened over 4 years, and the human condition and the human spirit, the souls have been so damaged. And the irony of what I call this, mass betrayal. And you're right, it comes down to Holocaust conditions that utilized the military. It invaded the military, it invaded the being of every household across the world. And it's going to be nearly impossible to fix it with any swift plan or methodology, because what has happened now, things have built upon it. And in every corner we turn, there's fear. And, we go into the election and we look at all that's happening, things that are so sinister. And if you can't tell me that there's not been a connection and a build to this point to today, I would say, well, then you're not really looking at things clearly. But that's where I see it. And my role as a psychiatric nurse practitioner has been just that. I lost the love for what I thought I was doing for nearly 35 years. And I said, how am I going to be able to give back? Because that's just who I am. I'm empathetic. I want to help people. And if I feel like I can't make a difference, then I'm powerless. And much like the night when we had the Vegas shooting, everybody had all hands on deck. Nobody had a badge. Nobody had a title. And we were there helping lives. That's what I believed this was all about. And then when the pandemic hit, and I learned so quickly, it was not about that. It was about a plan. It was about a motive. It was about a mission. And none of us were part of that mission or privy to know what it was. And any of us who tried to help and stop it were taken out. And it scares me for the future of the country and the future of the world, the future of our children and grandchildren. And God only knows the future damage of what's been done to our bodies with the vaccines and generations to come. So my role, I feel, is to help one person at a time and try to help people find value in their self, value in what they do, love in their connections with people around them. Because I think what's around us is such a scary, scary thing. It's too big for me to even imagine. And I just am trying to deal with one person at a time in everything I do. And to get the word out, question everything. And if you don't believe in it, stand up for it. Do not bend over or lie down. That's what we have to do as citizens of this country and as beings of Christ. That's it.
You know, I'm reminded of the verse discussing one falling at my side, 10,000 at my right, and yet it comes not near me, for he is with me. You know, Patty, I want to segue into our last question here, which is about the soul. It's about spirituality. It's about looking forward generationally as humanity, because we've clearly experienced an original moment, I would submit, in human history, a coordinated attack on the entirety of the peoples of the world with reverberations that are still occurring even now as we have this discussion. You know, the spiritual journey of the human being is a huge component, I think, of the life experience. It certainly gives myself vitality. I can only speak from my selfish perspective. But in my spiritual pursuits and musings, I have managed to find peace in troubled times. And so when we talk about healing of trauma, the absorption of things that have occurred, and then the release, ideally, of those troublesome emotions to living a better and fuller life, in your opinion, as far as you're willing to professionally go on air, what degree do you believe spirituality and the pursuit of who we are, maybe at a spiritual identity level, plays into that?
I believe that really is at the heart of our identity. Whether people have come to find a relationship with God, their being, their creator, it's really what empowers me and inspires me. I truly believe it's what gave me the words I had to share today, because I'm not always quite so straightforward and eloquent without making mistakes. And I think there has to be the element that through Christ all things, or through Christ all things strengthen me, simply because in my personal life, I've had enough challenges, personal trauma and pain that I've overcome so much. Never did I ever expect to have to go through something quite to this magnitude, but I truly believe that's what inspires me and empowers me. And I just truly believe that if people just hang on to hope, because hope is really what we have. We have hope. Hope and faith together is really where we can find some kind of peace and some kind of human kindness of what's really meant, and that's good to take over evil. I truly believe we're at the helm of fighting evil, and that's why I will not back down. I will be a voice, however small, until every last person that I can touch can believe that we can make a difference together. And so I say, stay strong, pray to God, you will get an answer. He moves mountains. And there's so many things that have happened. I truly believe that it had to be a God thing, because there's just no other explanation for it.
Made in the image and likeness of, indeed. And it is the promise of our future, I think, as humanity under God and as regents of this world, to move forward and to throw off this evil. And as you've described, it may take us a while, perhaps a generation or two or three, to fully have it under control. But I would submit that at this day and at this time, they have indeed overplayed their hand. Patti, it's been a tremendous honor to have you on. I thank you so much for spending time with me today. For the audience out there, I really hope you've enjoyed the chat. Let me, before we close off here, I don't want to forget this particular segment. Ms. Gilliano, where can Patriots purchase your book, connect with you in meaningful ways, and reach out to you if you'd like them to?
Oh, absolutely. I'm here to help just about anybody that's asking. And you can reach me at magnoliabehavioralwellness.com. My phone number's on there. It's really easy to get a hold of me that way. They Call Me Harriet is the title of my book, and it's easy to find on Amazon. Just type in They Call Me Harriet and my book will pop up, and it's also at Barnes & Noble. And for those folks who want to reach out, my office number is 904-377-1196. Feel free to leave a text message or a voicemail, and I will get back with you. And I appreciate the opportunity to share, because really we are one or many.
This has been one of the best audio chats we've ever had on the show. Ms. Gilliano, God bless you. Thank you for your story, for the pursuits that you've undertaken, and for your part in this great awakening. And for the audience out there, I hope you've loved the chat as much as I have. I'll be back with all of you again soon on the Q News Patriot channel. Thanks, everyone. God bless. Bye-bye.